Hello and welcome back to Rural Health Today. I'd like to take this opportunity to read an op-ed that I wrote regarding the devastating cuts that are being proposed by the Michigan legislature in the recent approval of their representative budget that will go between the House, the Senate, and then signed by the governor if it actually is fully implemented. Now, what we know as of today, both the Senate and the governor have indicated that the proposed budget from the House of Representatives is too devastating, it's too expansive, and it provides too many cuts to essential services in the state of Michigan. So to counter the concerns that have been created from this proposed legislation, I prepared an op-ed which I would like to read to you today. I'd like to thank the Detroit News for publishing the op-ed and to the Michigan Hospital Association for their support of our local hospitals across the state of Michigan, as well as their advocacy efforts in issues like this. Hillsdale Hospital has been supporting our community for over 109 years through everything from a public health emergency to economic downturns. As an independent nonprofit hospital, we exist for one reason: to care for our community. Our mission came under direct attack from the federal legislation and is now at even greater risk because of the Michigan House of Representatives' proposed state budget. If signed into law, this budget could slash more than $2.5 billion in hospital funding. This could result in the loss of 20,000 hospital jobs across the state and a $4.9 billion hit to Michigan's economy, an economy that is already struggling due to the rising prices across every industry. For hospitals like mine, where 70% of our funding comes from government payers like Medicaid and Medicare, the consequences of this budget would be devastating. This represents millions of dollars each year for Hillsdale Hospital to supplant and supplement the historical losses we have incurred from providing medical services to our Medicaid population. You know, what's most important is that we understand hospitals are not faceless institutions. We are neighbors, employers, and caregivers. Healthcare in Michigan is the largest private sector employer, with hospitals directly employing 122,000 people. We are proud to be the second largest employer in the city of Hillsdale, second only to our nationally recognized Hillsdale College, and third in the entire county. A 9% cut to the statewide hospital workforce, as projected under this budget, would ripple across every corner of the state, including Hillsdale. These are not just numbers on a spreadsheet. They are nurses. They are respiratory therapists. There are radiology techs and support staff who care for every day our patients, our neighbors, each and every day. These cuts would affect you as well, even if you aren't directly affiliated with healthcare. More than 1 million jobs in our state are either in healthcare or related to healthcare. When hospital funding is reduced, it sets off a chain reaction. Fewer hospital employees mean fewer people supporting local restaurants, hardware stores, grocery stores, small businesses, and even our schools. Communities where the hospital is one of the largest employers would feel these losses immediately. If services or programs must be shut down, these services close not just for our Medicaid patients, but for all patients in that community. The budget's proposed changes include moving $2.5 billion of hospital provider tax funding payments into contingency, eliminating $100 million from the specialty network access fee that helps doctors care for Medicaid patients, reducing $10 million that supports maternal and infant health programs. Creating a contingency fund adds bureaucratic red tape and has no connection whatsoever to the One Big Beautiful Bill Act. This is pure and simple government overreach on funds that belong to hospitals like Hillsdale and have been generated for more than 2 decades. Instead, it jeopardizes stability at the exact time when patients and communities need it the most. Like other organizations, hospitals rely on these reimbursements and timely payments. Without them, we cannot invest in our workforce or make improvements in infrastructure and technology that our patients desire and deserve. But behind all these economic numbers are real faces. I know this personally. Growing up in Hillsdale County, I saw firsthand how Medicaid helped my family of 7 to afford the care that we needed the most. It wasn't about politics. It was about survival and dignity. As a leader of Hillsdale Hospital, I see those same faces. They walk through the doors every day. I can relate a farmer from Camden struggling to afford his prescriptions that I spoke with, a local pastor using Medicaid to supplement his very low salary package, a young mother working at a gas station needing prenatal care. These are the real people, the real faces, along with those who care for them, the nurses, the techs, who will be left behind if funding is cut. This is not waste. They are not fraud. We are not abusing the system that exists to serve these gaps. It shouldn't be a political thing to care about each other. It's a human thing. Access to health care is not about how you vote. It's about whether your child can see a doctor, whether your aging parent can afford their medication, and whether your neighbor has a hospital close to their home when they have a serious health event. This is not fear-mongering, which seems to be the response when we lift up our collective voices for our neighbors. These are the facts. Cuts to hospitals under reduced provider tax is a cut to our patients' care. Hospitals like ours are here to serve a mission. We are doing everything we can to serve every patient who walks through our doors, regardless of their insurance, ability to pay, political affiliation, as all of these things quickly fall to the side when someone is in urgent need of care. Deep cuts to hospitals, physicians, and programs that support mothers, newborns, and children will definitely reduce access to care and force hospitals to put vulnerable patients at risk. When our community hospitals are weakened, entire communities are weakened. Our hospital provides more than just medical care. We sponsor community events, provide jobs, train future healthcare professionals, and serve as a safety net in times of crisis. Take away any funding, and you strip away the benefits that touch every corner of the communities that we serve. Lawmakers face a difficult decision when balancing the state budget, and we get it. But cutting healthcare is the absolute wrong answer. This proposed budget is a threat to Michigan's health, economy, and communities. I join my colleagues in urging lawmakers to reconsider these cuts. Protecting Michigan's hospitals means protecting Michigan families, Michigan jobs, and Michigan's future. Our patients, our workforce, and our state cannot afford to get this wrong.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.